So commonly people ask me, hey, Dr. Islam, what is a hiatal hernia? What is going on? What do I mean by having a hiatal hernia? So a hiatal hernia is very different from other hernias we have heard about. So most people, when they talk about a hernia, they talk about what's called an abdominal hernia, which is a hernia on your belly. You can physically see almost like an outpouching that's there. A hiatal hernia is a hernia between the esophagus and stomach, in which part of the stomach goes above where it should be. And commonly, this can cause symptoms of acid reflux, heartburn, and regurgitation. Now, if you're wondering, why do I have acid reflux? Sometimes a hernia can be the reason why you have acid reflux. And so not all hernias are made the same. And what we try to figure out is number one, do you have a hernia or not? Number two, how big and how wide is it? But also number three, is it causing your symptoms? So we usually use a measurement of about 3 centimeters or bigger for us to think that this hernia could be causing a problem. So not saying that smaller hernias can cause a problem, but in most cases, we try to use 3 centimeters. That's kind of the cutoff for this. So on this scope that I'm going to show you today, I'm going to show you a hiatal hernia. You can see I am looking back. That black part on the scope is actually me looking backwards, seeing what the hernia is. And with that, you can see a gap that's there. That gap that is there is the hiatal hernia. And that gap shouldn't be there. So when I take a look with the scope, I try to see, is there a gap between the black part, which is my scope, and where the stomach is at? If there is a wide gap or a long gap, that tells me, yes, a hernia may be the reason why you're having your issues. And with that, I can measure how that hernia is. Now, when I take a look with an upper scope as well, I look for other things besides just a hernia. I look to see if there's any damage from acid reflux. I also check to see if there's any issues or complications from that. But this is exactly what a hiatal hernia is, and there may be options to hopefully get that taken care of for you. Hope this video was helpful. If you like videos like this, where I'm showing you actual procedures, let me know in the comments down below. And also let me know in the questions, do you have a question about a hiatal hernia? Would you like other videos addressing hernias, or do you want to find out kind of my approach for figuring out a hernia or what to do? Comment down below. Your comments drive my videos, so let me know which videos you guys want, and hopefully I want to see you guys on future videos.